Hey guys, it's Phil here. Today we're going to be discussing diabetes. So, just a little introduction. Diabetes has a huge impact on people's health. It can lead to various foot issues, including nerve damage, poor circulation, and increased risk of infection and ulcers. Today we're going to be exploring connections between diabetes and your feet, and also the effects it can have on your overall health. And we're also going to be discussing the podiatrist role, what we can do to help you. So, the diabetic foot. Diabetes can cause nerve damage, known as neuropathy. This leads to a loss of feeling in the feet. It makes it very difficult for people with diabetes to detect injuries or problems, increasing the risk of infections and ulcers. This eventually can lead to foot wounds and amputations at its severity. Additionally, diabetes can impair blood flow to the feet, slowing the healing and process of further increasing the risk of your complications. Neuropathy. What is neuropathy? Neuropathy is a type of nerve damage caused by diabetes. It can lead to a loss of sensation in your feet, making it difficult for you to detect pain or even sensation. Symptoms of neuropathy, these include numbness, tingling, pain, and a loss of sensation in the feet and lower limbs. This can make it really challenging to feel cuts, say if you step on a piece of glass, for example. Further issues may develop from that. Risk of neuropathy. The reduced sensation caused by neuropathy increases the risk of developing foot ulcers and infections and other serious complications that will go unnoticed. So our role as a podiatrist, we can help in managing neuropathy through regular foot checks, custom fitted orthotics, and specialized treatments to improve your circulation and nerve function. This will reduce the risk of your complications. Circulation issues. As we know, diabetes can impair our circulation. Uh, this leads to reduced blood flow and eventually leads to impaired wound healing. So, for example, we cut ourselves accidentally. Um, that reduced blood flow will lead to reduced oxygen and nutrients leading to the wound. This will impair our wound healing and increase our risk of complications and infections. This eventually leads to things like peripheral arterial disease, which can be as a result of diabetes. Foot ulcers and infections. So this can be as a result of diabetes. Foot ulcer is caused by reduced sensation and poor circulation in a diabetic patient. So using that analogy we used before, if we step on a piece of glass and don't feel it because of neuropathy, this is what we end up with. And then eventually we can lead to an infected foot. This will reduce the complications, increase the complications of infection as a wound. So really important that you see a podiatrist to look at the wound and also for wound care. So us as a podiatrist, we provide wound care through wound management, skin, and also footwear modifications as well. So more about our role, regular checkups. We do something called a diabetic check and the diabetic assessment here at the clinic. We conduct regular foot examinations and also detect any nerve or blood flow issue using Doppler testing and also nerve testing using different instruments. Specialized treatments, so things we can offer such as wound care, custom orthotics if we need to offload a certain area that's a high pressure point, surgical intervention, and also address any specific diabetic foot problems. Preventive care, so the most important thing to prevent any diabetic complication, provide guidance on proper foot care, footwear education, including also nail and skin care. More preventive measures, so obviously we said before, regular foot exams. People with diabetes should regularly have a checkup at least every 6 to 12 months for diabetic assessment and also come in for regular skin and nail care. So maintaining good foot hygiene, including washing and drying the feet, trimming the nails properly and wearing well-fitting comfortable shoes can prevent the development of foot problems. So for example, a real tight, ill-fitting shoe may increase a pressure point, which will lead to further degradation of your skin wound. So any quick issues such as cuts or blisters and even signs of infection, uh, if it's noticed early, it's very crucial for individuals with diabetes to seek immediate treatment so we can get in there early and prevent any long-term chronic or even severe issues. Here are some percentages of pediatric treatments that we offer and that the population would have. So 85% would need wound care, some would need orthotics, some need surgical intervention, and most people require 92% will provide and need preventive nail and skin care. So coming in on a 2 3 monthly basis, and having that routine care to prevent any further issues long term. In conclusion, so diabetes we know has a significant impact on someone's health and even their foot health. Us as a podiatrist, we can provide specialized treatments to take care of you and prevent any long-term serious complications. Regular foot care is the most important thing, making sure there's no issues with the skin or nails that can lead to open wounds or infections elsewhere. If you guys are having a problem with this, give us a call. We'll see you next time. Thanks, guys.